Hello everyone. In this video I am going to discuss about frequently asked questions regarding systematic reviews. I have conducted several workshops, training program, seminars, mentored review teams conducting systematic reviews, and also taught students in several courses related to systematic reviews. So I have compiled some of the questions which participants frequently asked. So I thought it will be useful for everyone. So the first question is about the difference between systematic review and literature review. So we all know that we see publications as literature review and some publications as systematic review. So what is the difference? So the purpose of a systematic review is to answer a specific research question. But more frequently for a literature review, it is to provide an overview or context. But sometimes there could be also specific research question. The second aspect is about the methodology. Systematic review is more structured, systematic, and protocol driven mainly, and it follows an explicit, accountable, and rigorous methodology. Literature review, on the other hand, is more flexible and narrative. Coming to the search strategy, systematic review search strategies are comprehensive and reproducible. But in literature review, it is more selective and variable. Bias control, that is an important difference between systematic review and literature review. In systematic review, controlling bias is an essential step. We need to minimize bias by doing several measures. For example, double data extraction, quality assessment of individual studies included, and several other quality assessment checks we do in systematic review. But in literature review, that is not necessary, and that is subjected to more bias. Quality assessment is an essential step in conducting systematic reviews, and it is rarely done in literature review. Data synthesis. For systematic review, we have defined data synthesis methods like quantitative methods like meta-analysis, qualitative methods like meta-ethnography, mixed method research designs, and several other synthesis methods are employed in systematic reviews. But in literature review, it is mainly a narrative or a qualitative summary is provided. Sometimes you will also see meta-analysis done in the context of literature review. But systematic review always stands apart because it is more systematic, it has a defined methodology, and it is described in detail how it is conducted. Hope this is clear to you. So the second question is about how many databases should I search? I have come across these questions frequently from the review teams and people conducting systematic reviews. So how many databases should I search? It is difficult to specify an exact number of databases to search, as this depends on various factors such as the nature of the research question, the discipline, and the need for a comprehensive coverage. For instance, systematic reviews of clinical trials often include Medline, Embase, Central, and several other databases. For topics related to nursing, it is advisable to include CINAHL in the database search strategy given its focus on nursing and allied health disciplines. So it is also depends on discipline specific databases are there. For education, it is ERIC database. For sociological research, it is ASIA or Social Science Abstract, and other databases are there. Other topic specific databases such as PsycInfo for psychology, ERIC for education, ASIA for social science. So it is very difficult to tell a specific number, but it depends on various things. And also if it is a broad type of systematic review question or it is a broad map, we may have to search several databases. But we need to include the key thing we have to remember is we need to include the key databases related to the topic. And people also search, other than the databases, we need to search some website, maybe sometimes hand searching of journals and then other organizational websites, registries. So several type of search sources we need to employ. And another point here is we need to also search the regional databases. For example, if the study is from India, we need to search some of the regional databases. And if the study is from Latin America, there are specific Latin American databases. So it depends upon, so there are some principles guiding the selection of such databases. It needs to be comprehensive and we should be able to pick up the important studies in the field. And it should be covering the topic in a more comprehensive way. So coming to the third question, how many total sources should I search? So this is something again related to the sources, which includes the database. While there is no fixed number of sources to search, a comprehensive approach is recommended. This typically involves consulting bibliographic databases like Medline, ERIC, PsycInfo, etc. Specialized trial registers. There is Cochrane Trial Register, International Clinical Trial Registers, etc. Internet search engines like Google Search. Websites of relevant organizations. Sometimes we may search websites of relevant organizations like UNICEF, WHO, or other government or non-governmental organizations. And we may have to scan the reference list for additional studies. So it is difficult again to mention a number about how many total sources should I search. I came across this question very frequently, but it is very difficult, so we can only give some information or some guidance regarding how to look for a wide range of sources which include the studies relevant to your topic. Fourth question, this is also commonly asked, how many people are required to do a systematic review? So whether it is two people in a team or 3 or 4, what is the number required? A systematic review typically requires at least 2 to 3 people. So it cannot be done by one person, that is for sure. So a minimum of 2 is required, though larger teams are often preferred for quality and efficiency. So here is how the rules usually break down. So minimum team composition, like 2 independent reviewers, that is essential for screening studies and extracting data to reduce bias and ensure reliability. So we need to do double screening, double data extraction, piloting, all that. So we need at least 2 independent reviewers. And it is preferable to have one adjudicator which resolves disagreements between the 2 reviewers. Optional roles, and it is desirable to include an information specialist or librarian. They help to design and execute comprehensive search strategies. So it's very useful to have information specialist, especially when we have to search a variety of databases. We need to employ the advanced search strategies. So it is advisable to have a librarian to get a full coverage of the search strategies in various databases. It is also advisable to have statistician or methodological expertise, methodologist, assist with meta-analysis and other methodological aspects of the systematic review. And it's also desirable to have a subject matter expert who can ensure relevance and accuracy in interpretation of the findings. So this is the minimum team composition. So you need to have a minimum of 2 independent reviewers and 1 moderator, and optional roles like information specialist, statistician, or subject expert. So sometimes one of the reviewer also could act like a information specialist or a statistician or a subject matter expert. So the next question is about how many studies should be included in a systematic review. This is another difficult question to answer. So there is no fixed minimum or maximum number of studies required for a systematic review. The number depends on the topic, available literature, and inclusion criteria. So here is some recommendation or general guidelines. Minimum. A systematic review can be valid with as few as 2 to 3 studies, especially if the topic is narrowly focused and well defined. Maximum, there is no upper limit. Reviews can include hundreds or even thousands of studies if the scope is broad and the literature is abundant, especially when we do the mapping or the evidence gap map or the systematic map. We may include several hundreds of studies because it is usually done on a broad topic. Zero studies. Surprisingly, a systematic review may include no studies at all. This outcome highlights gaps in the research and is still considered valuable. So you don't have to worry actually about, because there is no included studies, you don't have to worry about the systematic review finding, because that itself is a finding which points towards a major gap and recommendations for conducting primary research. So key consideration, quality over quantity. It's more important to include studies that meet rigorous eligibility criteria than to aim for a high number. So the quality of studies, we need to have a very detailed, rigorous inclusion criteria, and then you include the studies. Defined by PICO or other type of framework, the population intervention comparison outcomes, which is a popular framework or commonly used framework, helps determine which studies are relevant. There are other types of frameworks also available. Transparent criteria. Inclusion and exclusion rules should be clearly stated in the review protocol. So there is no fixed minimum or maximum number of studies to be included for a systematic review. Next question is it necessary to register a protocol for a systematic review? So registering a protocol for a systematic review is strongly recommended. It ensures transparency, that the review follows a predefined plan. However, it is often an iterative process and is useful to report any deviations from the published protocol. So it is strongly recommended to register a protocol, but maybe you have to make some deviations when you conduct the systematic review, and that has to be reported in a transparent way. Credibility. Registered protocols increase the trustworthiness of your findings and are often required by journals for publication. So most journals recommend registering the protocol, and that is a requirement for publication of a systematic review. And it avoids duplication. It shows others what you are working on, reducing the chance of redundant reviews. So when you register a protocol, you will be able to search that a particular systematic review is planned or not in protocol registry sites. So it improves planning. A protocol acts as a roadmap, helping your team stay aligned and organized throughout the review process, although deviations may be necessary. So it is very useful to have a protocol in place, and to before conducting the searches, it is good to have the protocol and the plan, but you may also need to make some deviations or necessary iterations as relevant, and that has to be reported. So if you need a protocol, then where can I register a systematic review protocol? That is also asked by the participants. So the commonly used site is Prospero, that is the most widely used international registry, mostly for health-related systematic review, and it is hosted by the University of York in United Kingdom. There is also Open Science Framework or OSF platform, suitable for all disciplines, including social sciences, education, psychology, engineering, and so on. And it offers flexible registration and version control. You can also register protocol in Cochrane library for reviews conducted under the Cochrane collaboration, and that requires an affiliation with a Cochrane review group, and then you can register in Cochrane library. Campbell collaboration also also there is a provision to register the protocol. It focuses on systematic reviews in social policy, education, and international development. And when the protocol, there is a particular format to be followed in this type of registries. In PLASI, International Platform of Registered Systematic Review and Meta-Analysis Protocols, it also helps in fast registration process and open to all disciplines. So there are various places you can register your systematic review protocol, and respective platform provides a format for what items to include in the protocol. Another question which is also very commonly asked, when is it appropriate to undertake a systematic map? So when I say systematic map, it is mapping. So it doesn't involve synthesis of findings. So systematic map, sometimes it's also called evidence gap map. So systematic mapping is most appropriate for broad, multifaceted questions on a topic of interest that may not be suitable for systematic review, particularly when multiple interventions, populations, or outcomes are involved, or when the evidence extends beyond primary research. So mapping is very relevant when there is a broad topic of interest. You don't have a refined systematic review question, but you know what you want, what is the topic, you know. So in that case, mapping is very useful. It is often employed within a two-stage model of evidence synthesis. First, to comprehensively characterize the evidence base, and subsequently to identify subsets of studies that can be used to address more focused questions through systematic review. In my experience, I find this two-stage model is very useful. And often when we do not have a focused systematic review question, the mapping really helps to narrow down the area to synthesize. Question number 9 is about what is the purpose of conducting a systematic map? When do we conduct a systematic map? Previous slide I explained about it is on a broad topic area. So to develop a greater understanding of concepts, to identify evidence for policy relevant questions, to identify reviews which can be used to generate higher level evidence products such as guidelines, and to identify knowledge gaps, topics that are underrepresented in the literature that would benefit from primary research, and also to identify knowledge clusters, that is subsets of evidence that may be suitable for secondary research, for example using systematic review. So knowledge clusters, that is like a two-stage process, like first we map and then we can identify the cluster for synthesis. So these are some of the purpose of conducting a systematic map. Now the key question is, how does a systematic map exactly differ from a systematic review? Both follow the systematic review methodology, but there are some difference between systematic map and systematic review. The key difference is in the area of objective. Map is broad, describes the state of knowledge for a question or topic. So to identify the broad base of research studies on a particular topic. Review, systematic review on the other hand, aims to answer specific questions such as effectiveness of interventions, views of people, etc. So systematic review questions are more specific. Coming to the data extraction, for the map, detailed study findings may not be required. So we may extract some information related to the population, type of intervention, type of outcome, type of setting, etc. But detailed study findings may not be required. But in systematic review, we need to extract the detailed study findings. Critical appraisal is an optional step in systematic map. Critical appraisal, sometimes we do critical appraisal of some studies. That means the systematic reviews included in a map can be appraised, not for all the primary studies, because often systematic map involves several hundreds of studies and different type of study types. So it is an optional step. It is not a compulsory step. But in systematic review, it is a compulsory step. All included primary studies are critically appraised. Synthesis, that is, there is a key difference in the way we can approach the synthesis. No formal synthesis carried out in a map. It is mainly to describe, categorize, or to identify the clusters of primary research. In systematic review, some form of synthesis is employed, like meta-analysis, thematic synthesis, mixed method synthesis, etc. Another relevant question, especially in recent years, because of the advancement of technology and the software, this question is very relevant. Which software can be used to create a systematic map? So there are some softwares for systematic map. There is a software EpiMapper. EpiMapper is our tool that for visualizing maps of research evidence, built initially to support the Campbell Collaboration's evidence gap map. It is available for all EpiReviewer users at no charge. So EpiMapper is within the EpiReviewer software and it is available to all users at no charge. Another software called Tableau, also used in providing the systematic evidence gap map. Atlas is another software used. Evidence gap map by 3IE has developed an interactive online platform that allows users to explore the evidence in a particular evidence gap map EGM with links to user-friendly summaries and full-text articles were available. So 3IE organization also produce evidence gap map EGMs and they have a software that can be used by people who are producing 3IE evidence gap map. So when to conduct a review of systematic reviews. So a review of systematic reviews or overviews or umbrella reviews, all this terminology you can see in the literature. A review of systematic reviews or overview of reviews or review of reviews takes a step further by systematically searching for and appraising and summarizing multiple systematic reviews on the same topic to provide a higher level synthesis. So here we are not looking at the primary studies, we are looking at the systematic reviews on a given topic and trying to synthesize the systematic review. That's a higher level synthesis of multiple systematic reviews. So we usually do when there are multiple systematic reviews on the same topic. It is some of the common topics or popular topics. When there are several systematic reviews published, we can do an overview of systematic reviews. So the next question is there a cutoff date for the search when publishing a systematic review? I know this is a problem encountered by some of you. When you try to publish a systematic review, you get a comment that your search date is outdated. So some journals or some reviewers recommend that it should be within 6 months, 1 year, like that. So is there a cutoff date, and why there is a cutoff date, and is it justifiable? So rigorous and complex systematic reviews often require more than 12 months from the search date to publish. So keeping a cutoff date like 6 months or less than 12 months is a difficult process when your systematic review is a very complex systematic review, because you need time from the search. After that, the several processes there, like you need to screen the studies, data extraction, synthesis, all that, it requires time. So it requires more than 12 months if the systematic review is very complex. Not all type of review are at risk of being outdated. So the main issue with the journal when you publish the systematic review is you will get a comment that your findings may be outdated. So it's not like all type of review are at risk of being outdated. It depends on the review topic. There are fast moving areas such as newer intervention that could be outdated, not all the topics. So most often qualitative and mixed methods reviews are unlikely to have their findings substantially changed by the inclusion of new evidence. You must have also noticed this. Like I have noticed that when I have done a qualitative synthesis and then tried to see what the new studies are bringing in any new findings, most often it is a similar things. It is like the conclusions are not changed much. Cochrane Handbook recommends that searches are as up to date as possible, specifying within 12 months, but ideally within 6 months of publication. It also acknowledged that reviews with a broad scope will require more resources. So there is a recommendation by the Cochrane that the search has to be updated when you publish, like 12 months or within 6 months of publication. So few things we need to consider here when we are thinking of the search cutoff date. What is the priority? The need for useful and rigorous complex reviews versus up-to-date evidence. So as I mentioned before, rigorous complex reviews you may need more time. So the priority is whether you need a more nuanced understanding of the findings or you need a more up-to-date findings. Consider how likely any new or additional studies change the review findings. So this is the authors can take into consideration when you are submitting to the journal. You can check that whether the new studies or can make any change in the findings. So you can also report that in the discussion section that you have looked for new studies but it did not alter the findings much. Depth of review work. Sometimes new studies will be just slotted into keep it up to date rather than integrating it. May work in narrow effectiveness review. So just because the requirement is that you need to have an updated search, the review authors may search for studies and just slot in the studies rather than integrating it in a more deeper way. So more of narrow systematic reviews get published if a strict rule is followed regarding the last search date. Complex, rigorous, extensive reviews may go unpublished, resulting in substantial research waste. So this is something that journal editors and reviewers have to keep in mind, that if you are very strict about the rule without considering the topic, without considering the fact that whether the new research can change substantially the findings of the systematic review or not, if you are very strict about it, what can happen is more narrow systematic reviews get published and complex, extensive, rigorous reviews because it took some time, that it go unpublished, resulting in substantial research waste. So a 12-month rule means that review authors who opt to undertake more complex reviews or engage in extensive PPI or extensive stakeholder engagement run the risk of non-publication of their findings. So this is something very important to consider. Now question 14, that is, why is stakeholder engagement important in a systematic review? We often heard about involving stakeholders is desirable and it is very useful to conduct a systematic review, and why that is important. Stakeholder engagement aims participatory research and might direct the research question, define the scope and context of the review, as well as contribute to the literature search, evidence synthesis and interpretation, and might facilitate dissemination and use. So there are several benefits in involving stakeholders. Enhances the relevance of findings for policy and practice and contributes to the sustainability of health systems. Stakeholders helps to broaden understanding a different perspective, because often we academic or the researchers comes from a different perspective, but the actual stakeholders or the users of the reviews, the potential users, could provide a different perspective. And it helps to reduce bias by providing critical and transparent approach, and to make the review more relevant for target audience. And they also improve accessibility by translating jargon. So most often involving stakeholders help us to simplify the information to be used for the general public, to encourage wider dissemination of the review by using different communication style. So often the stakeholders will be involved in dissemination and use of the systematic review findings. So it is an organic way the systematic review findings will get disseminated. Some challenge and complexities involved in stakeholder engagement, and we need to plan these things in advance. We need to select carefully who are the stakeholders. We need to map the stakeholders who are relevant to the topic, and also there is some resources involved to bring them together, and also to conduct meeting. And we also need soft skills to manage the different stakeholders. Sometimes also it is challenging when the stakeholders when they have their own diverse interest, and then when the stakeholders are not able to come into consensus, when they have very different opinions and vested interest. So all these are to be considered, but stakeholder engagement is very important in conducting systematic review, especially for policy and practice. So when should stakeholders be involved? Stakeholders may engage in some or all stages of a review. Depends on your resources, depends on the need. You can involve them at some stages, or you can involve them at all stages of a review. Involvement range from prioritizing review questions to commenting on draft findings. A greater level of involvement often occurred in reviews focused on health or social inequalities. So the involvement can be consultation, can be collaboration, can be also co-production. So they can also part of producing, co-authoring the systematic reviews. Users could be involved in the review team. Their inputs are useful in protocol development, especially in formulating review question, conceptual framework, and inclusion criteria. So during the conceptual stage, it is very important to involve the stakeholders to help us clarify the concepts, to identify the framework, relevance, etc. They could help in identifying relevant studies. Sometimes not every stakeholders, if they are from an research background or some information or some practitioners, they are able to identify relevant studies, could be involved in data extraction. They also can be involved in study quality and relevance. Maybe some of them may require some training or some help or some guidance, but they could be also involved in this process. They provide input helpful in synthesizing relevant findings, and they are very useful in dissemination and communicating the findings. So we have some examples of involving stakeholders, and they contributed a lot in the review relevance and enhancing the quality, and also actively contributed in disseminating the review findings. Next question is about, should we use software to conduct a systematic review? Earlier we have seen about software to use in doing a systematic map. Now the question is whether we need to have a software to conduct a systematic review. It is highly desirable to have a software, and many people increasingly using these softwares in conducting systematic review. For example, we have many softwares like AP Reviewer, Covidence, Distiller SR, Ryan, and many others. The benefit of using systematic review tailored software is that it enables review teams to perform different steps of the review process, like study selection, data extraction, critical appraisal, with progress being tracked in real time within the software. So we can also do systematic reviews without using any software, but it is more tedious and laborious process. So by using a software, you can also see simultaneously work on certain steps, and you can see how the progress is made, and in real time you can monitor the systematic review process. This helps the review team by providing a comprehensive, transparent, and up-to-date report of the review process, and also it helps in making some of the steps easier. For example, duplicating, to deduplication of studies, like to remove the duplicates. Systematic review software help to remove the duplicates. There are also other software can be used. Reference manager software also help in removing the duplicates. But systematic review softwares have several functionality which will help in the systematic review process more efficient. I would like to focus on specific collaborations and organizations here. Campbell Collaboration, they produce systematic reviews on various topics ranging from criminal justice, disability, education, international development, knowledge translation and implementation, nutrition, social welfare. And Epicenter, the place I work, education, social policy, health promotion, public health, international systems and development. Reviews you can find from Epicenter website. Joanna Briggs Institute, they produce healthcare related systematic reviews. 3IE, International Initiative for Impact Evaluation, they produce mainly evidence gap map. And Collaboration for Environmental Evidence Center, Environmental Science website. And Cochrane Collaboration, systematic, they have a systematic review database, Cochrane database of systematic reviews. So these are some of the organizations. You can see the collection of systematic review in their website. Where can we find systematic reviews? You can see some of the sites here. Social Systems Evidence, you can find in this particular site. What Work Centers UK also publish some systematic review. Campbell Collaboration website gives systematic reviews. Epicenter, we have a database of systematic reviews. And then we have DOFR database, and then you can have publications from Evidence Library. And then we can also find systematic review in various journal publications. So these are some of the reference I used. I used many more reference. These are some of the key reference I used to produce these frequently asked questions and answers, and many of the answers also from my experience and the experience of the other review team members. So these are some of the frequently asked questions. Many more questions are there. This is only part 1. So thank you for listening. Hope you benefited from this video. Thank you again. Welcome back. I'm going to continue with frequently asked questions part 2. So the first question here is, what are the main approaches to synthesis in a systematic review? So this is frequently asked by the participants, what approaches we have to take for synthesis in systematic reviews. So broadly we can categorize as aggregation and configuration approaches. So what is this aggregation? In aggregation, we add up the findings from primary studies to answer review questions. So that is the predominant method here, adding up the findings. So a typical example is meta-analysis. It is closely associated with testing hypotheses such as determining the effectiveness of interventions. So this approach is commonly employed when we need to test the effectiveness of interventions. So aggregation without statistics require grouping and summarizing information as in thematic summaries. So if you are not doing any statistical compilation, the aggregation require grouping and summarizing information. An example is thematic summaries. So the next approach is configuration. So what is configuration? Configuration predominantly arrange the findings from primary studies to answer the review question. So the examples are meta-ethnography, thematic synthesis. So here a range of concepts from primary studies is interpreted and configured to create higher order or meta concepts. Extended meta-analysis to understand differential impact in population groups could be more configurative. So though we mentioned that meta-analysis is an aggregate approach. But extended meta-analysis, when we have to look at how the differential impact in population groups, then it is more of a configuration. So all reviews have some aspects of configuration and aggregation. So it's very difficult to say that a review is typically configurative or aggregative. But we can say predominantly the synthesis approach is either configurative or aggregative, because most of the reviews have some elements of configuration and aggregation. It does not simply reflect quantitative or qualitative paradigms. So generally speaking, aggregation is more done with the quantitative type of findings, and configuration more in qualitative type of findings. But you can see from this example that is not restricted to only qual or quant, because from qualitative data we can also have an aggregative approach, and from quantitative data we can also have a configurative approach. Moving on to the next question, what is a SWAR? SWAR, SWAR. So SWAR stands for study within a review. Study within a review, the short form is called SWAR. So it is a research study embedded within a systematic review or evidence synthesis. So it is a study within review, within a systematic review. And what is the aim for that? To improve how reviews are planned, conducted and shared. So basically it addresses methodological uncertainty in review process. So it's mostly a methodological type of study. Provide evidence to inform future review decisions and evaluate alternate methods of organizing or delivering reviews. So it's a study within a systematic review, mainly aimed to improve the methodological aspects. So may be embedded in a single systematic review or multiple reviews simultaneously or over time. So you can conduct SWAR within a single systematic review, or you can conduct across a group of systematic reviews, multiple reviews. So we use existing review data or require minimal additional data. So it is a study conducted within the review. So we mainly make use of the systematic review data itself. It offers a cost-effective way to improve review methodology, because anyway the systematic review is done. So we are undertaking another methodological study to improve the process. So we don't have to do a completely new systematic review for that. So it's a cost-effective way. It helped to assess the impact of review process on findings and conclusions. So this is what is called SWAR. Moving on to the next question, question 21. This is one of the important questions asked. Which tools assess primary study quality in systematic reviews? So we all know that we use different type of primary study designs in a systematic review, and what tools are appropriate. We need to use some tool because critical appraisal is an essential step in systematic review process. So some of the tools I would like to mention here. The first one is CASP, Critical Appraisal Skills Program. And the CASP website, they offer a variety of tools based on study design. So you get checklist and the details about the tools from CASP website. The second website I would like to mention is from Joanna Briggs Institute. So they have critical appraisal tools in their website, and there are several type of tools mentioned for different type of study designs. Then we have a Cochrane risk of bias tool for randomized controlled trials. So the earlier version was ROB tool, and now the second version is called ROB 2. So that is available from Cochrane ROB2 website, which contain detailed guidance. There is a crib sheet to help in the assessment process, and also there are templates provided, there are webinars, there is a full guidance document, and various other resources are there in the Cochrane ROB2 website or the web page. So there is another tool from Cochrane for non-randomized studies of intervention that is called Robin's tool. So that is also available from the Cochrane website, and that has guidance and the associated publications for Robin's tool. There are also tool available from Effective Public Health Practice Project Quality Assessment Tool for Quantitative Studies and Newcastle Ottawa Quality Assessment Scale for Case Control and Cohort Studies. So these are some of the most commonly used tools to assess the quality of primary studies in systematic reviews. Next question is, what are the reporting guidelines for systematic reviews? So this is very important because we need to follow these guidelines when we have to report or publish a systematic review. And the most popular and the most important one here is PRISMA checklist. So PRISMA stands for Preferred Reporting Items for Systematic Reviews and Meta-Analysis. So this is considered as a standard for reporting systematic reviews. It's the most widely used checklist or guideline for reporting systematic reviews and meta-analysis. So the latest version offering a 27-item checklist, a flow diagram to track study selection, and the guidance for reporting methods, results, and rationale. So it's a very comprehensive tool and is recommended for reporting the systematic reviews. There are several extensions for PRISMA, which includes PRISMA for scoping reviews, PRISMA for protocols, PRISMA for outcome measurement instruments, PRISMA for living systematic reviews. All these are available from the PRISMA statement web page. So the second type of reporting standard is called MOOS. That is meta-analysis of observational studies in epidemiology. So this is specifically for observational studies in epidemiology. Then there is another reporting standard called ROSES, Reporting Standards for Systematic Review, Evidence Synthesis, tailored for environmental systematic reviews and maps, and that is also available from the reporting site. So the next question is slightly different than the reporting standard and quality assessment tools. That is about priority screening. So what is meant by priority screening? It is based on machine learning and text mining approach to screen titles and abstract. We all know that screening is an essential process in systematic review. We mainly conduct two-stage screening. First is screening title and abstract, followed by full text screening. So this priority screening is employed in the first stage, that is screening titles and abstract. So the reviewing software learns from researcher screening decisions to identify likely included or excluded citations. So we screen a set of studies initially, and then the machine learning, the software will pick up the studies based on the inclusion and exclusion criteria. A subset of citation is used to train machine learning algorithms based on inclusion criteria. So we need to do it manually and train the machine learning algorithms. Then we can employ the priority screening functionality. The algorithm ranks items for manual review, placing the most relevant studies at the top. So what we get here is, from the set of included studies, we will be able to see the most included studies or the most relevant studies on the top of the list, and then we are able to screen them manually. Citations are sorted iteratively so that most likely to be eligible for inclusion in the review are screened first, prioritizing these to significantly speed up the screening process. So users manually assigned include exclude labels to automatically apply this classification to new records. So this will improve the efficiency of screening process, because once we get the relevant records on top of the list, so we don't have to screen the full set of studies. We can decide on certain factors like baseline inclusion criteria, or based on the review teams, we have to make certain decisions when we can stop screening once we obtain most of the relevant records. Another important question is, when should a mixed method systematic review be conducted? So this is an emerging methodology in systematic review. You can see more and more publications using mixed method synthesis. And there is obvious advantage and benefits for doing a mixed method synthesis. So the commonly asked question is, when should we do mixed method synthesis? So a mixed method systematic review, otherwise called MMSR, should be conducted when your research question requires understanding both the effectiveness, that is quantitative evidence, and the meaning, experience, or context, that is qualitative evidence, of an intervention, phenomenon, or issue. So basically it's a mixed method, so we need more than one method. Usually quantitative methods are mixed with qualitative methods to develop a comprehensive understanding about the topic of interest. When there are complementary bodies of evidence, if both qualitative and quantitative studies exist on the topic, combining them prevents loss of valuable insights. So we can get the perspective and we can get the advantage of both qualitative and quantitative type of studies. This focuses on real life contextual understanding and multi-level perspectives. It combines rigorous quantitative research like measuring magnitude and frequency with rigorous qualitative research exploring meaning and understanding. Uses multiple methods such as intervention trials and in-depth interviews, and it integrates findings to draw on the strengths of both approaches. So there are several approaches to mixed method systematic review, and the latest classification, it is comprised of three approaches. It is assimilation, comparison, and connection. Moving on to the next question, like what tools are available to assess the quality of systematic reviews? So we may have to appraise the quality of systematic reviews, and there are several tools are available, and the most common one and the most rigorous tool is ArmStar tool. That is a measurement tool to assess systematic reviews. It is one of the most widely used tools. It evaluates methodological quality of systematic reviews. ArmStar 2 is an updated version which assesses reviews that include both randomized and non-randomized studies, and it covers 16 items including protocol registration, search strategy, risk of bias, and synthesis method. All about the tool, assessment, guidance, everything is available from the ArmStar website. The second tool I would like to mention to assess the quality of systematic review is ROBIS, that is risk of bias in systematic reviews, specifically designed to assess the risk of bias in systematic reviews and conducted in three phases: assessing relevance, identifying concerns, and judging overall risk of bias. The target audience of ROBIS is primarily guideline developers, authors of overviews of systematic review. So when we have to do an overview of systematic review, then we need to assess the individual systematic reviews. So this tool is, ROBIS tool could be used. ArmStar also could be used, and review authors who might want to assess or avoid risk of bias in their reviews. So ROBIS is another popular tool used to assess the risk of bias of quality of systematic reviews. The third tool is CASP checklist. I mentioned about CASP when we discussed about the quality appraisal tool for primary studies. So there is also a CASP checklist. to appraise systematic reviews, and it provides a structured approach for appraising systematic reviews, and it focuses on validity, results, and relevance of the review. And it is useful for practitioners and students in evidence-based practice. So this tool is also available from the CASP website. JBI tool. JBI also has tools to appraise the quality of primary studies, and they also have critical appraisal checklists for systematic reviews. It is developed by Joanna Briggs Institute, that is JBI, and it evaluates review methodology, search strategy, appraisal process, and synthesis approach. And this particular tool is suitable for reviews of both qualitative and quantitative evidence. So that's all I would like to explain in this video. Hope these videos are useful, at least to answer some of your questions related to systematic review. See you soon with more videos. Thank you.